Hello everyone, myself Dr. Rajesh Khanna, Consultant Pediatrician, KIMS, Cuddles, Kondapur branch. Anemia in children, today's important topic. By definition, anemia means hemoglobin less than 2.5 standard deviations below the mean for that age and sex. Usually hemoglobin goes down due to two reasons. One, if the production of hemoglobin itself is very less, or if hemoglobin is excessively degraded and excreted from the body. Low production, as you all know, can be due to less intake of iron or B12 majority and folic acid. Iron deficiency itself a major predominant reason for low hemoglobin levels. Whereas other reasons, if you look, hemoglobin can be increased, degraded or excreted from the body during thalassemias, sickle cell anemias, or even due to excess blood loss during trauma. We will focus on nutritional anemia, that is due to lack of iron and folic acid. Around 67% of children in India are anemic. Anemia by itself goes unnoticed, and no parent brings their child due to the concern of anemia, that is low hemoglobin. It's basically during examination in our OPD outpatient checkup that anemia in children is diagnosed primarily by looking at their eyes, pale conjunctiva, that is palpebral conjunctiva, that is called pallor. So majority of times it is due to a broad suspicion, due to clinician suspicion and examination finding. It's assumed the child is having low hemoglobin, and iron is the one which is supplemented by large scale. So majority of the kids improve their hemoglobin by simple supplementation of iron itself. Few of them needs B12 and folic acid. Whether the cause is due to iron or B12 folic acid is again when you do at least a complete blood picture, whether they are microcytes or macrocytes, you will know if it is microcytes iron deficiency, or macrocytes it can be due to B12 deficiency or folic acid deficiency. Iron rich foods like dates, anjeer or green leafy vegetables, milk, dairy products, meat. So iron itself from the diet is not that reliable, because soil is deficient in nutrients, as you all know, and the food is also deficient in nutrients. So supplements are definitely needed when you are diagnosed anemic. So along with nutrition, supplements are mandatory to take, especially for pregnant and lactating women. If they are iron deficient, if they are anemic, definitely their newborn babies and infants are iron deficient and they are anemic. Simple measure of iron supplementation to pregnant and lactating itself can take care of anemia in newborns and lactating women. Iron by itself is a bad taste, so majority of the kids don't accept the taste of iron syrup, so it becomes a challenging when you are treating. But these days different varieties of iron supplements are there. If child is not accepting one kind of syrup, you can try the alternate ones. We also got some sachets to sprinkle on the foods and food substitutes. Iron fortified foods is also a latest phenomenal novel technique, wherein you will just enrich the iron content of the food so that children can continuously get the iron supplements. Iron deficiency, if left untreated or if anemia goes unnoticed, then hemoglobin, to our surprise in our outpatient practice, we see hemoglobin of 3 or 4 when just a complete blood picture is done as a routine health checkup investigation. Such kids definitely need blood transfusion after all ruling out all other possible causes. So blood transfusions becomes inevitable if hemoglobin goes less than 6, and it impacts heart also. So heart failure eventually sets in if anemia is very worse, if there is severe anemia. So by this I will enlighten you all that Anemia, if it is untreated, it can result in so many other subsequent effects, like anemia leads to anemia is a part of malnutrition leading to recurrent infections in children, heart failure if left untreated, as well as you get many complaints from children that they are having leg pains when they are doing some sort of simple, trivial, playful activities. So that should arouse suspicion when they are just complaining of leg pains. And simple jaggery based snacks to them, sesame seeds chicky or til chicky, if you are giving that jaggery as a rich source of iron, and you have got plenty of iron rich foods, as well as take one supplement as prescribed by the pediatrician, then you can definitely avoid this pandemic of the century, that is anemia. Thank you all for giving me this opportunity.